Hello?
Hi, my name's Alicia with the San Francisco Department of Public Health. May I speak with Pat Mejia, please?
Yeah, this is Pat.
Great, thank you for taking my call. As I mentioned, my name is Alicia with the San Francisco Department of Public Health, and I am calling with an important health message. But first, in order to confirm I'm speaking with the correct person and protecting privacy, would you be able to provide your date of birth?
Um, sure, it's 7 to, wait, why do you need my date of birth again?
Just in order to confirm that I'm speaking with the right person before sharing some confidential information. But actually, it's okay if you're only comfortable sharing the month and date.
Okay, yeah, so 7/2.
Okay, yes, that does match what I have on record. And what is your preferred language?
English is fine.
All right, perfect. Let's continue. So, as a member of the COVID-19 contact tracing team, I'm calling to let you know that you have been identified as a close contact to a person with confirmed coronavirus. Do you have a few minutes to discuss what that might mean for you?
Uh, yeah, wow, that sounds really scary, actually.
Yeah, this is kind of big news. What are you thinking?
Um, I guess mostly just worried about what that might mean, like if that means that I'm for sure gonna get it or not.
Yeah, I could totally understand that concern, and I think we should definitely address that. Um, and that's really why I'm calling today to help talk about any concerns that you might have. Um, so, yeah, what I'm hearing is that you're kind of wondering, does this mean you're definitely going to get it? What other questions do you have that we'll talk about today?
Um, I guess just kind of following that, like, well, I guess kind of both. Like, what do I do now? And then also, like, what if I do get it? Then what do I have to do?
Okay, yeah, that makes total sense. So, you're wondering if it means you'll get it, and then, what do you do now? And then what do you do if you do get it?
Yeah.
Does that sound right?
Yeah.
Okay. So let's definitely plan to talk about those three things. There's a few things that I'm hoping to talk about. So I'm hoping to talk a little bit about how you're feeling and any symptoms that you might be having. And then, yeah, share some important information about the virus and, about what you need to do now. And yes, exactly, like what you would do if you got sick. Um,
Okay.
so, would it be okay if we start with your question about whether or not you're definitely going to get the virus? And then
Yeah.
talk a little bit about how you're feeling and any symptoms you might be having. And then we can go over some important information about coronavirus and quarantine, which is, I think, will address your questions. How does
Yeah,
that
that
sound?
sounds good.
Okay.
That sounds good.
Great. I'm thinking this will take about 20 minutes. How does that sound to you?
That's good. I have time.
Okay. So, for your question about whether you're definitely going to get the virus, the answer is no, not necessarily. So, what we know is that you have been in close contact with a person with confirmed coronavirus, but we don't necessarily know that you will get it.
Okay.
Um, it can take up to 14 days from exposure to develop. So that's why I want to provide you with some information about what to do during those 14 days.
Okay.
Okay. Um, Before we talk anymore, let's make sure that I have your correct information on file. I have a few questions to determine how I can help you and also to understand where the virus is occurring and among whom. And I just want to let you know that as we're talking, I'm entering information into a secure database. So if I pause for a minute, it's because I'm making sure that I have everything in there correctly.
Okay.
Okay, and a quick note on privacy. So this information will be provided to the California Department of Public Health and your local health department in San Francisco, but it will not be shared with any other federal, state, or local authorities, such as Immigration and Customs Enforcement, Homeland Security, or local law enforcement. Okay.
Okay.
And so I'm going to ask some questions now. So please stop me if you have any questions about what I'm asking or if anything comes up.
All right. Thank you.
What is your first name and last name?
It's Patricia, and the last name's Mejia.
Great. Could you spell that for me?
Sure. It's first name is Patricia, and last name is Mejia.
Great. Thank you. And what is your date of birth?
July 2nd.
All right. And are you comfortable sharing the year?
Sure. It's 67.
Great. Thank you. And what is your address?
2111 Shotwell Street in San Francisco.
Great, thanks. And is this number that I called you on the best number to contact you?
Yeah, that's my cell number.
Okay. And is a phone call the best way to contact you in the future?
Yeah, phone or text. Sometimes I forget to put my ringer on, so a text might work better.
Okay, I'll mark down that you like text. And what is your email address?
It's my name, so patricia.mejia@gmail.com.
Great, thank you. And are you a healthcare worker?
No.
Okay. Where are you working currently?
I work at San Francisco General, but I'm not a healthcare worker.
Okay. So before we move to the next section, so I want to let you know that we ask everyone the following questions, and you can decline to answer them at any time. They're meant to help us understand, where COVID-19 is occurring and who it's affecting so that we can better plan the interventions that we develop.
Okay.
So what race or ethnicity do you identify with?
Latina.
Okay. And so would you say that you identify as Hispanic?
Yes.
Okay. And how do you identify or prefer to be identified in terms of your current gender?
Female.
Okay. And how do you describe your sexual orientation?
Straight.
Okay. Thank you so much for answering all of those questions. I know there are a lot. What questions do you have for me at this point? Has anything come up?
No, nothing new. I don't think so.
Okay. So would it be okay if I now read through a list of symptoms that are common with COVID-19? And have you let me know if you've experienced any of them in the past 3 days?
Sure. Yeah, I think I know some of them, but sure.
Okay. So have you had any chills or fever?
Yeah, I noticed at night that I get, I don't know if I have a fever, but I know that I get really like shaky, kind of, it wakes me up.
Oh, okay. Would you say you would describe that as chills, shivering, or shaking?
Yeah, it almost feels like when I've had the flu in the past.
Okay.
I don't think I have a fever, but it's that same kind of, yeah, like chills.
Okay. And so you don't feel like you have a fever?
No, I don't think so.
Okay. And it sounds like, have you measured your temperature by a thermometer at all?
I haven't.
Okay. And what about any cough, shortness of breath, or sore throat?
My throat has been feeling a little like kind of like a tickle, like dry a little bit.
Okay.
Yeah, but no shortness of breath. No, just that.
Okay. And what about any abdominal pain, diarrhea, vomiting, or nausea?
No, no, none of that.
No, none of those. Okay.
Mm-mm.
Okay. And then just a few more. Any headache, loss of smell or taste, or muscle aches?
No.
Okay. And what about a runny nose?
I do get a runny nose, but I think that's my allergies. It's usually just in the morning, and that's like normal for me this time of year.
Okay. And has it changed at all in the last few days since you started having the other symptoms that you mentioned?
No, it's been the same. Yeah, I wake up with it, and then like after a little while, like, an hour or two, it clears up. It's been
Okay.
the same.
Okay. And then what about this is a little bit of an odd one, a red purple rash that can be itchy, burning, or blistering, mostly on your hands or feet.
Yeah, that is weird. I haven't heard of that one related to COVID. No, I haven't had any rash. Any
Okay.
nothing that I can see of. No.
Well, I'm sorry you've been having, some symptoms. Um, is there anything else that you can think of that's been abnormal that I did not mention?
Um, no, I guess just having a hard time sleeping, but I feel like that might be because of the chills. Like I keep waking up and then it's hard for me to get back to sleep.
Yeah. Ugh, that sounds so frustrating.
Yeah, it really is.
Yeah. So have you been really tired during the day?
Yeah, it's been making waking up in time for work a little hard.
Oh yeah. And so are you having to travel to work or are you working from home?
No, luckily I'm working from home. I've been working from home since the whole shelter in place started.
Okay, yeah. That's good. At least you don't have to do that commute. Um,
Yeah, yeah. I
so
just had to go in once a few days ago, just to meet with somebody really quickly. But other than that, I'm working at
oh, you
home.
did. Okay. How many days ago was that?
Let's see, that was on about 4 days ago.
Okay. Okay. And what date did your symptoms first start?
I want to say, let's see. So I went into the office Monday. I want to say it was Tuesday. That's when I first started. That was the first time that I woke up with the chills and my throat
Monday.
feeling weird.
That was
Uh, Tuesday, yeah. Monday was when I went into the office. Tuesday was when I started feeling the sore throat and the waking up stuff.
so Monday night into Tuesday morning. That's what the first time you started waking up.
Oh, yeah, you're right. Yeah, it would be Monday night.
Okay. So overnight Monday into Tuesday. Um,
Right.
all right. Thank you for sharing that. Um, and are you still having any symptoms today, Friday?
Yeah, I woke up a couple times with the chills again last night. And then yeah, my throat just feels like it's not painful. It doesn't feel normal. It's a little like sore, and I can kind of hear it in my voice that it's just not normal.
Okay. Well, thank you for sharing that. I'd like to ask just a little bit about testing. Have you been tested for COVID-19?
Yeah, I actually got tested 2 days ago.
Oh, good. I'm really glad to
So
hear that you were able to do that. What was your result? Do you
I,
know?
I don't know. I haven't gotten it back yet.
Oh, okay. And do you have a regular healthcare provider?
I do. I do.
Okay, that's good.
Should I
And
call? Should I call my doctor?
have you been in touch with them yet since you started having these symptoms?
I sent a message on the electronic medical record thing, but sometimes it takes them a couple of days to respond. Do you think I should call?
Yeah, I think it would be good to be in touch with your doctor and just let them know that you've been exposed to someone with a confirmed case of coronavirus and that you're having, the symptoms that you just mentioned to me.
Okay.
How does that sound to you?
Okay. Yeah, that sounds good. I'll give her a call.
Okay. And when do you think you might be able to call her?
I have some time this morning, so probably after we finish our call.
Okay. Yeah, that sounds awesome. And do you know how you will be receiving your test result?
Honestly, I don't really remember. I don't know if they were going to call me, or I don't remember.
Okay, that may be something for us to talk about, but it also might be something that would be good to bring up with your doctor's office, and they may be able to help you figure that out.
Okay.
Okay. Great. So I have a few questions about medical conditions that place people at slightly higher risk for severe illness. So I'm just gonna, again, kind of like the symptoms, go through a list of conditions. So do you have, or has a doctor ever told you that you have asthma or another breathing condition like COPD?
No.
Okay, and what about cancer?
No.
Okay. Any chronic liver or kidney disease?
No. Luckily, no.
Okay. And any diabetes or heart disease?
No.
Okay. And any immune conditions such as HIV or undergoing chemotherapy or organ transplant?
No, none.
Okay. And just to kind of follow up on that, have you ever been told that you get infectious diseases more easily than other people?
No. No, luckily I've been pretty healthy.
That is very good to hear. What about any neurological or neurodevelopmental diseases?
No.
Okay. And what about obesity?
No.
Okay. And are there any other chronic diseases that you have that I have not mentioned?
No. At least so far, I've been lucky. I've been pretty healthy.
Great. And are you a current or former smoker?
No. Never found smoking appealing.
Good. Good to hear. And any current e-cigarette or vaping use?
No.
All right. And are you currently pregnant?
I really hope not. No.
All right. Thank you for sharing that information. And for your time so far. I know this is such a long interview. Do let me know if you need a break or anything.
Okay.
How are you doing so far?
So far so good. I really appreciate the information. So
okay, good.
It's worth the time.
I'm glad to hear so far so good, even though you probably are very tired from waking up in the night.
True.
Okay, so a few more questions and then we can start talking about, some of those questions about what to do now. So as I mentioned, we're contacting you because you've been in contact with someone with confirmed coronavirus. Are you aware of having had close contact with someone who's positive in the last 14 days?
That I know of, no. I mean, we've pretty much been staying home, although, sometimes go shopping or things like that. So I'm kind of surprised, actually, and a little worried because I don't know if that means maybe other members of my family might have been exposed too.
Okay, yeah. So you're kind of, you're wondering if someone else may have brought it into the home and they may have also been exposed.
Yeah, or if we were together at the time that I was exposed, and because people can have it without showing symptoms, right?
That's right. Yeah. So there can be cases where
Yeah.
people don't show any symptoms. So, speaking of sort of that idea of who in your family's been exposed, who do you live with?
I live at home with my two boys.
Okay.
They're young adults.
Young adults. Okay. How old are they?
Let's see, the youngest one is 21, and then the middle one, his brother, is 23.
Okay, 21 and 23. Those are probably not the most fun ages to be living through a pandemic.
Yeah, they actually, yeah, one of them just came home for a visit, and then the shelter in place happened. So he decided to just stay back home. But they keep me entertained.
It's the visit home that never ends.
Yeah. I think we're both looking forward to when, he can head back.
Yeah,
back to college.
Also live with my parents, so I can definitely relate.
Yeah, it's fun sometimes.
It's fun sometimes. Well, maybe it's nice to get that time together.
Yeah, for sure. I just wish he would do his own laundry once in a while.
Yeah, that's me. Yeah, I can understand that. So it's your two boys. Is there anyone else living with you?
No, just the three of us.
Okay. And do either of them have any chronic conditions like the ones I mentioned before? Diabetes, heart disease?
No. Luckily, they've both been healthy.
Okay. And
although one of them did use e-cigs for a while.
What?
Is that going to put? He used those vaping pen things
for
like 2 years. Is that going to put him at higher risk?
That's a great question, and I'm not 100% sure of of how much that would put him at risk, but it's definitely something I'll note down, and that you could ask your doctor about.
Okay.
And additionally, I will describe how you guys can be kind of cautious and staying apart from each other just to be careful.
Okay, that sounds good.
Okay, so some vaping. Do either of your boys have an immune condition or have had cancer?
No.
Okay, and what about severe?
No. I'm sorry, what was the last one?
Sorry, severe obesity?
No.
Okay, and then the last one, has either of them received a transplant?
No.
Okay, so I'll just make a note of the vaping. How would you describe where you all live? Is it a home, an apartment, an RV?
Yeah, it's a home, like a 3-bedroom home.
Okay, and it's a standalone home, so you don't live with other people, or is it kind of more like a?
Yeah, no.
Okay.
No, it's a regular house. We just the three of us.
Okay. Great. So now I think thank you for answering all of those questions. I'm ready to, get into that, those questions that you had about, what do I do now and what do I do if I do get sick?
Okay, great.
So we are asking all people who have come into close contact with COVID-19 to quarantine. Would it be okay to talk a little bit about what that means?
Sure.
Okay, so what do you know about quarantine?
I know it means you have to stay home. I think it also means that you are supposed to stay separate from like the people you live with. I had a family member who had COVID several months ago, so I'm trying to remember what it is she told me. So I think she was like super careful about like she would go down to the kitchen and make her food and then like wash everything and make sure that nobody like shared like her, like she kept her utensils and plates and cups separate.
Mm-hmm.
And would only go downstairs like if she knew the coast was clear and nobody else was there. And I think she told me that she would carry like those disinfectant wipes with her, and just like as she went down the stairs, she would like wipe the handrail and stuff because she really didn't want her family to get sick.
Yeah, wow. It sounds like she really had it down. Um,
Yeah.
I'm sorry to hear that had that experience. Is she okay now?
Yeah, yeah. It was hard for her for a little while there, but luckily, she didn't end up in the hospital, and she's doing okay now. She still, I think she might have some of that long COVID. Is that what they call it? When
Ugh,
she
yeah.
just gets really fatigued once in a while. It just hits her.
Yeah.
But could have been a lot worse. So we're just really happy that she made it through.
Yeah, wow. Okay. So it sounds like you've actually learned a lot from her in that experience. Um,
Yeah.
I'd like to go over some additional information. And I have quite a few things to share. So don't worry too much about remembering it all or writing it down, because I can send you a
Okay.
copy of the information by email or text, whichever you prefer.
Okay.
And go ahead and stop me if you have questions. Um,
Okay. Thank you.
it's really awesome that you already know so many things. Yeah. So the idea behind quarantine is to stay home and to separate yourself from others, especially now that you have been exposed to COVID-19. Um, and for COVID-19, quarantine should last for 14 days from the time you were last exposed. Now, it sounds like you don't actually know when you were last exposed, so we'll go ahead and use today's date. Um,
Okay.
so today is the 6th, and I'm just going to pull up my calendar here. So the end of quarantine for you would be November 20th.
Oh, right before Thanksgiving. That's good.
Yes. Yes, freedom before Thanksgiving. How do you feel about that 2-week time period?
Um, I think it's okay. I mean, I know because of my cousin who had it, but that's how long it was for her too.
Hmm. Okay.
Yeah, I mean, there's a couple of mostly I'm worried about my boys, but I could, if I feel okay, I can keep working because I'm already working from home. So I think it'll be okay.
Okay. Yeah. So it sounds like you're kind of on board with it. I just want to reiterate that even if your test result comes back negative, saying you don't have COVID, you still need to stay in quarantine for the entire 14-day period because you're still
Oh
at
wow.
risk of becoming infected during that period.
Okay. Okay. I hadn't thought of that, but yeah, that makes sense.
Yeah. So, and I know you've been having some potential symptoms. So while most people get sick within 4 to 5 days of exposure, it can take up to 14 days. Um, and during that time period, you should actively monitor your symptoms, kind of like you've been doing. So those symptoms include all of the things I mentioned before, fever, chills, cough, feeling short of breath or tired, having a headache, sore throat, muscle aches, congestion, nausea, vomiting, diarrhea, or a new loss of taste or smell. So I know that's
Okay.
a long list, so we will include that in
Yeah.
the email we send you or text.
Okay. Great.
With the fever, I just want to add a little something. So to determine if you have fever, I'd like to recommend that you take your temperature using a thermometer at least 2 times a day. And if one of those readings shows a fever, wait at least 1 hour and take it again to confirm it. And that would be without taking any meds that reduce a fever like Advil or Tylenol. Um,
Okay. So I should take my temperature even if I don't think I have a fever. I should just do it twice a day.
yeah, just take it to get that like concrete reading. Um,
Okay.
do you have a thermometer?
I do. I do.
Okay, great. And then we talked about this is since you're having symptoms, you should call your provider and just let her know and kind of have a conversation about what that may mean. And I know you've already been tested, so making sure to follow up on that test result.
Okay.
Um,
I'll do that for sure.
And then you should also look out for any emergency warning signs for COVID-19. So that would be things like trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake up or stay awake, and bluish lips or face. And if you have any of
Okay.
those, I strongly encourage you to call 911 or go to an emergency facility and call ahead to let them know that you have been exposed to COVID.
Okay.
Okay. So I just shared a whole bunch about, monitoring your symptoms. And just to make sure that I explained it clearly, would you mind describing in your own words what you'll be doing for monitoring your symptoms?
Okay, if I remember it right, I'm supposed to just kind of watch out for any of the symptoms like coughing or shortness of breath, stomach pain, all those ones that you listed. And if I develop them, definitely, well, I'm going to call my doctor anyway, but if I get new symptoms, I should call. And then I think you said that I should take my temperature, even if I don't think I have a fever, I should take my temperature every day, 2 times a day. And then call 911 if I have like a lot of trouble breathing, or if I can't remember the last part. I think something about having bluish, like if my lips turn blue or something.
Yes, absolutely, exactly. If you get a blue lips or face, that's an indication that you're not getting enough oxygen.
Okay.
So, and I will be sending, this information in an email. So you'll have that list of symptoms and emergency symptoms to look out for.
Okay.
Yeah, so you pretty much had that down. If you do get a reading on your thermometer that shows a fever, what will you do?
I think you said take it again, right? I
Yeah,
don't remember.
exactly.
Okay.
So yeah,
Okay.
we just want to, confirm that reading was, an actual fever. So we recommend wait 1 hour and then take it again
Okay.
without taking any meds to bring down that fever.
Okay. So an hour after I take it. Okay.
Yeah. And I just want to reiterate, it's really important to separate yourself from others. So whatever you can do to keep yourself and your boys separate. It sounds like you've got 3 bedrooms in your home.
Yeah.
And then there's a few other things you can do to reduce the risk of spreading the virus to others during this period. And you actually already mentioned a few of them. So staying separate, like you said, making food separately, absolutely. I think that's a great idea. If your boys can, do their laundry and make their food themselves, that would be great.
Maybe this will be the thing that gets them to start doing that
Yeah,
regularly.
maybe this is the moment, right? This is the time for them to spread their
They won't have a choice.
Yeah, and then I love that idea of keeping utensils separate, not sharing, household items like towels, utensils, things like that. And then, yeah, I like this image of your family member walking down the stairs with a wipe, but we definitely recommend, using wipes as much as you can and disinfecting.
Okay.
So I'll just go through a few more things if that's okay to add.
Sure.
Okay. So do not leave your home except if you need urgent medical care. And if you do need urgent care, make sure to wear a face mask or cloth face covering. And like I said before, to notify them that you're coming and have been exposed. And do you have, how would you get to a medical appointment if you did have to go?
Well, I think if I feel okay, because like right now, at least I feel okay, and hopefully I'll stay feeling okay. So I would probably drive myself. Otherwise, I guess I don't know, because I wouldn't want to have one of my boys drive me, right? Because the car's small, and would that be an okay thing to do?
Right. Well, I think you're right that if you're feeling well, the best thing to do would be to drive yourself, and
Okay.
definitely to not take public transportation or any kind of ride sharing. Um, but
Okay.
if you are, you know, in a situation where it's an emergency, you could have your one of your boys sit in the front, and you could sit in the back with masks on and the windows wide
Okay.
open to keep that airflow
Got
going.
it.
Yeah.
Okay.
Um,
Okay.
of course, the other option is to call 911, and you know, an ambulance could come out. Hopefully
Okay.
that won't be an issue, but just kind of thinking through the options.
Okay. Yeah, that makes sense.
Okay. And do you have any visitors in your home usually lately?
Well, one of my boys, his girlfriend sleeps over every once in a while. Should we probably shouldn't have her do that, at least for the next couple of weeks, right?
Yeah, totally. So for the next 2
Okay.
weeks, you really don't have any visitors in your home until you've cleared
Okay.
that period. Do you think that will be possible?
Yeah, he's probably not going to like it, but I think he'll understand. He'll want to protect her. So.
Okay, you can tell him I'm going to call him and you know, read him the riot act.
All right. All
Um,
right. I'll let him know that.
okay. And then you want to make sure to cover your mouth with a tissue when coughing or sneezing, and then throw that tissue away.
Okay.
Wash your hands frequently throughout the day with soap and water for at least 20 seconds. And you really, really want to make sure to wash your hands before and after preparing food, before and after eating, after going to the bathroom, and after any sneezing, blowing your nose, or touching your face.
Okay.
Yeah, because the virus can spread on your hands, so you just want to keep washing them to keep it off of there.
Okay. The
Yeah, we
touching your
are.
face one is hard.
Yes, I know,
I
it's
always
so
forget.
hard.
I always forget.
It's so hard. I've been trying, since March to keep my hands off of my face, and yeah, it's really difficult.
Yeah. I think I actually just did it like a second before you said that.
Okay. Well, maybe
So
now that
yeah,
I've
I'll
said
have
it,
to try to remember.
you'll be really aware of it.
Yeah.
Okay, and then we already talked about wiping down surfaces that you touch frequently. So that would include things like your phone, which is a super high touch surface. And then also clean your bathrooms every day. Actually, I haven't asked yet. How many bathrooms do you have in the house?
We have two.
Okay, you have two. So would it be possible for you to use one and the boys to use a different one?
Yeah. Yeah. I have a bathroom like in the master bedroom.
Oh,
So
okay.
that's usually the one I use mostly anyway.
Yeah, so that would be good. I would still encourage everyone in the house to clean the bathroom every day, after
Okay.
using it, just because like you said, we don't know who was exposed. Um,
Right.
so yeah, if you could kind of add that into, I know I already gave the boys some laundry and food making, but just kind of keeping that bathroom really, really clean.
Okay. Okay.
Okay, so I think we've been through almost all of these things. They give me a super long list to share with you. We talked about keeping windows open in the car. That can apply to the house as well. So any kind of air movement through the house. Um,
Oh, can I ask you a question about that?
yes, please.
Um, so do those air purifiers, are those helpful? Because like we bought one, um, but we haven't really used it much. We haven't needed to. Do you think that would be helpful?
That is a great question that I actually do not know the answer to. So I could actually look into that and get back to you. That would be helpful for me to know for other people as well.
Okay.
Um, yeah, so I will look into that. Thank you for bringing that up.
Okay. Yeah. No, thank you for finding the answer for me. I guess it wouldn't hurt to use it, but
yeah, that's a great point. And it doesn't hurt if you've got it. And my filter makes a lot of noise, so I keep turning it off. But if you're comfortable leaving it on.
Yeah.
Okay, I know that was so much information. If you want any more information on COVID-19, you could go to the Centers for Disease Control website. Do you have access to the internet?
Yeah, I do.
Okay, would you like to take the name of this website down?
Sure.
Okay.
Hold on, let me just grab a piece of paper. Okay.
Okay. It's www.cdc.gov/coronavirus.
Okay. And is coronavirus all together?
Yeah, all one word.
Okay.
And
Okay.
like I mentioned,
Great.
I can also follow up with an email or text message.
Okay, that would be great too. Thank you.
Okay, what other questions do you have based on all that information that I just gave? I do have a couple more things to go through, but I want to stop and see what questions you have.
I don't know that I have other ones. I think it's actually sounding a little bit more challenging than I thought in the beginning. 2 weeks of staying home, but realizing all the different things you have to do. But I think we can manage it.
Okay, yeah, I mean, I hear some hesitancy in your voice. What sounds challenging to you, or what feels most challenging?
I think mostly, like, I can separate myself probably pretty easily because my bedroom's on a different floor, but the boys, they're on the same floor. And so I guess I'm just a little worried that if one of them might have been exposed but not the other, you know what I mean? That then they're kind of they're at higher risk just because physically they're closer to each other.
Right, yeah. And what options do you think they have for keeping apart?
I think just, I think if I just kind of explain it to them, I mean, they know how serious this is since my cousin got it. And she tried really hard to keep the rest of her family from getting it, but a couple of them got it anyway. And we're all really worried for her. So I think if I just, if we just talk it through, they'll probably try their best to keep away from one another.
Yeah, okay. So it sounds like having a conversation, kind of a sit down conversation with them.
Yeah.
Well, a couple things. Would it be helpful to have either me or one of my coworkers call them and, speak with them about kind of all the things that you and I talked about today?
Yeah, actually, I think that would be really, really helpful. I mean, I can do it. I can do some of it too, but I don't know that sometimes it helps hearing it from other people, and maybe they'll have questions for you that they won't ask me because I'm their mom.
Yeah, exactly.
Yeah. Yeah, that would be, if you could do that, that would be really great.
Yeah, let me be sure to get their phone numbers from you.
Okay.
And the other thing I just want to reiterate is that when you do have that conversation with them, you should stay, at least 6 feet apart with a mask on. So stay across the room from each other at least, or even,
right.
You could do it on the phone. So just want to make sure to put that out there.
Yeah. No, thank you. Because I realized that this has to start now. Okay.
Yeah. So starting ideally after everything up. So do you have enough food or groceries to get you through the 2 weeks?
Yeah, we actually just went grocery shopping this past weekend.
Oh, perfect. Okay. And do you need any meds that will run out in the next 14 days?
No.
Okay. And yeah, I just kind of want to check in with you. So I know you mentioned, one barrier, and I want to ask, so on a scale of 0 to 10, where 0 is not at all confident and 10 is extremely confident, how confident are you that that you'll be able to carry out this quarantine until November 20th?
I think I'm pretty confident. I probably would say I want to say a 10, but probably like a 9 or an 8.
Okay.
Because it's, we know this is really serious. So probably like a 9.
All right, a 9. So that sounds like you're really confident. And I hear you just mentioned it feels really serious. I would agree. I think this is a very important steps to take, and I'm really, really glad we've been able to have this conversation. So before we end the call, I just want to let you know that I might be calling you again to follow up. And you may be contacted by another staff member at the health department to check in on you. And they will ask you questions about your health and well-being to make sure you're okay. But we could also send you text messages. How does that sound to you? Are you able to get text messages?
Yeah, I actually kind of prefer text to phone calls because, like I said, I always forget to put my ringer on.
Okay, noted.
So yeah, text would be great.
Noted. Yes, I know you had mentioned the text earlier, and then I know I also mentioned that we can send some of that information by email. How does that sound?
That sounds great.
Okay.
Yeah, because it was a lot.
And I know we got your email earlier. So that was a lot. Thank you so much for taking the time to talk to me today. Do you have any other questions for me, or is there anything else you need to be able to take care of yourself during this time?
I don't think so. I'm just, really grateful that you called and shared the information with me. If I do have questions, can I call you back, or can I respond to like an email or one of those texts?
Absolutely. So before we get off, let me give you a phone number. It might not be me that you reach, but someone at the contact tracing team. So that number is, do you have a pencil or pen and paper?
Oh yeah, just a second.
Okay.
Okay.
Sorry, I didn't want to. Okay, so it's 555 555 5555.
Okay. Well, that's easy to remember at least.
Yes, exactly. And I am going to look into that filter question, so you will hear from me.
Oh, right.
If you are in need of emergency medical care after this call, do call 911 and tell the operator that you're seeking care for COVID-19.
Okay. Hopefully I won't have to do that.
Yes, yeah. Absolutely. Hopefully not. And I know you mentioned you're going to call your doctor after this call. Mm-hmm. Okay. And I just want to thank you again and assure you that, your efforts to stay safe and protect others in our community are so appreciated and so important. So thank you so much. And, take care of these next 2 weeks.
All right. Thank you. I appreciate you sharing all this information with me.
All right. Bye. Thank you so much.
Bye-bye.